Let me start by completing the introduction of the team from the Ministry of Health. Like the ED has introduced, we have Dr. Charles Ayume, the Honorable Minister of State, Ministry of Health, in charge of primary health care, is here with us. We also have Dr. Diana Atwine, the Permanent Secretary, Ministry of Health. And together with us, we also have Dr. Daniel Chabayinze, the Acting Director General of Health Services, and substantively the Director in charge of Public Health in the Ministry of Health. We also have Dr. Atek Kajirita, the Incident Commander for this Ebola outbreak. Kajirita in my language means the razor blade. So the man in charge of cutting Ebola with the razor blade. So this is Dr. Atek Kajirita. We also have Mr. Ime Ainebiona, who is the Senior Communications Officer. He is part of you. You should actually have sat that side, but this is from Ministry of Health, he can as well sit with us here, but he's our Senior Communications Officer. And lastly, we have Madam Abe Kalanathan, who is a Technical Assistant in the Ministry of Health. Thank you very much, Uganda Media Center, for organizing this briefing, and thank you, members of the media. I don't know whether you have already voted or whether you are going to vote immediately after here, but we would like to appreciate you for finding time at short notice and for coming to be part of this media briefing. Now, the title of my statement, which I am just going to read to you, is Uganda declares the end of the 2026 Ebola disease outbreak. And today is the 28th of July, 2026. So permit me to just go through the statement, then after which we may pose questions or points of clarification, if any, and then we shall respond to them and then conclude. Now, the Ministry of Health is pleased to announce that Uganda has officially declared the end of 2026 Ebola disease outbreak. So today, as we speak now, Uganda is Ebola free. The declaration follows the successful completion of the mandatory 42-day monitoring period, which began after the discharge of the last Ugandan national, a locally transmitted patient, on the 16th of June, 2026. Throughout this period, the Ministry of Health maintained intensive surveillance nationwide, and no new Ebola cases have been detected. Unlike previous Ebola outbreaks that informed the 42-day declaration policy, Uganda's 2026 Ebola outbreak arose from a fully documented importation event. The source of infection was identified, the route of introduction established, all confirmed cases were epidemiologically linked, transmission chains were completely characterized and reconstructed, and all identified contacts were institutionally quarantined and completed the mandatory 21-day follow-up without evidence of further transmission. Enhanced surveillance has detected no unexplained community transmission. I must hasten to add that we are counting from the last Ugandan national who was discharged, because the last case that we discharged of a Congolese national was a gentleman who came in a cargo truck hiding in a cargo truck, and he was the last patient we discharged, but he had no contacts at all. And therefore, we are counting from the last Ugandan national whom we discharged on the 16th of June 2026, and counting today, we have completed the 42 days. Since the development of the current international guidance, significant advances have transformed outbreak investigation and response. Today, rapid molecular diagnostics, whole genome sequencing, digital surveillance, real-time contact tracing, and strengthened incident management systems provide a level of epidemiological certainty that was not previously possible. These advances have been particularly important during the current outbreak. Genomic analyses have confirmed that the circulating virus represents a distinct individual virus variant, while additional evolutionary studies continue to expand our understanding of how this outbreak emerged. Together, these findings demonstrate that scientific knowledge of Ebola viruses continues to evolve. The ministry recognizes that the long-standing 42-day criterion has served the global public health community well and remains an essential safeguard in outbreaks where transmission is uncertain or ongoing. However, where an outbreak results from a fully characterized imported event and epidemiological closure has been conclusively demonstrated, a fixed time interval alone may no longer represent the only basis for determining that transmission has ended. Uganda declared the Ebola outbreak on the 15th day of May 2026, following the confirmation of imported cases from the Democratic Republic of Congo, DRC. During the outbreak, Uganda registered a total of 20 confirmed cases, of whom 18 recovered, while 2 unfortunately lost their lives. Of these cases, 15 were imported from the DRC, while 5 were Ugandan nationals who acquired the infection as care workers of the imported cases. I also hasten to add that the 2 who died were Congolese nationals who had traveled into Uganda for medical care, but they came late, and that's why they died. Uganda has defeated this outbreak because of the strong investments the government has made over the years in building resilient public health systems. Our ability to quickly detect cases, trace and monitor contacts, provide quality treatment, strengthen laboratory services, and work closely with the communities ensured that the outbreak was rapidly brought under control. This achievement also reflects the commitment and professionalism of our frontline health workers, the vigilance of communities, and the close collaboration between government, local leaders, security agencies, and partners. And we extend our appreciation to all these friends, ranging from health workers to members of the community that have been very vigilant and playing their role. As part of our regional response, the government of Uganda signed a memorandum of understanding with the government of DRC to implement a cross-border joint Ebola response. In light of this, Uganda has set up 2 mobile laboratories and an 80-bed Ebola treatment units in Aru and Kasenyi in the DRC. Containing the outbreak at its source is critical, protecting both our countries and the wider region. The Ministry of Health expresses its sincere appreciation to His Excellency the President of the Republic of Uganda for his unwavering leadership and support throughout the response. We equally thank our frontline health workers, district local governments, community health workers, security agencies, communities, you, the media, researchers, partners, and all Ugandans for your relentless hard work and sacrifice. Although Uganda is now Ebola-free, our work does not stop here. We will continue strengthening surveillance, maintaining preparedness across the country, particularly the border districts, and working with neighboring countries to safeguard the health and well-being of our people. The Ministry of Health appeals to the border communities to remain alert and report any illegal entry of persons into the country. Persons with suspected symptoms should be taken to the nearest health facility and also report through our toll-free line 0800 100 066. Let me repeat that persons with suspected symptoms should be taken to the nearest health facility and also report through our toll-free line, which is 0800 100 066, or send an alert SMS to 6767. The Ministry of Health wishes to assure all Ugandans, visitors, investors, and members of the international community that Uganda is safe. Our health system remains fully alert, and the country is open for business, tourism, and all socio-economic activities. I say this for God and my country. So thank you very much, members of the media. So that is a brief statement that we are issuing to say, beginning today, Uganda is Ebola-free, and I now invite questions, comments, or any points of clarification. Would you want me to start with Uganda straight away? So you have no question? Because usually, sometimes we get questions, so the Uganda version incorporates the answers, the questions, as we conclude. Yes? Mwagana soke mu Uganda. Okay. My Uganda is really the best. It is infected with Ruchiga, but nonetheless, you will get what I'm saying. Olwaleero tuli basanyufu tuzze wano ng'abakulembeze ba ministry ery'obulamu, ate ndi wano n'abakulu, n'omukulu Minister Charles Ayume, nina Permanent Secretary Wekitiibwa Diana Twine, n'abakulu Acting Director General Health Services Mukulu Dr. Dan Chabayinze, n'abakulu abalwanisa ekirwadde kino ekya Ebola. Nti tulangirira nti okutandika n'olunaku olwaleero tetukyalina ekirwadde ekya Ebola mu Uganda. Kubanga mujjukira nti mu mwezi ogwokutaano ennaku 15 twalangirira nti tulina ekirwadde ekya Ebola mu Uganda, kubanga twafuna omusajja Omukongo eyajja mu Uganda ng'anoonya obujjanjabi n'afa, naye ne tumujja kukoza sample ne tusanga nti yali alina ekirwadde ekya Ebola. Okuva olunaku ogwa 15 Meeyi twafuna abantu 20 abatestinga ngo balina akawuka aka Ebola. Ate ku 25 bali ba Congo, bakwano baffe ab'e Congo abayingira mu Uganda ngo banoonya obujjanjabi. Katwasembayo okusiibula omulwadde Uganda ennaku 16 mu mwezi ogw'omukaaga 2026 kati kuva olunaku ogwa 16 June okutuuka leero kati tuwezezza ennaku 42 kubanga mu byokisawo omukujanjaba ekirwadde kya Ebola tubala ennaku 42 wakamala okusiibula omulwadde asembayo. Waliwo omulwadde mu Congo gwe twasiibula ennaku 16 omwezi guno, naye oyo yava e Congo ngu ali mu motoka eya cargo, so teyabeera ne contacts. Oyo tetubalira ku oyo, tubalira ku onu Omunnayuganda owafuna ekirwadde ate twali tulowooza nti waliwo risiki y'okusaasaanya ekirwadde n'abeera ne contacts. Kati kitegeeza nti kuva 16 omwezi ogwa June ngu twakasiibula omulwadde tetufunangayo omulwadde omulala bw'atesitinga positive oba ngu alina obubonero obw'ekirwadde ekya Ebola. So kati tukakasa nti mu Uganda tetukyalina ekirwadde ekya Ebola. Lwaki? Olwaleero ennaku 28 omwezi ogw'omusanvu ngu tumaze ennaku 42 okuva olunaku luli ogwa 16 June twasiibula Munnayuganda. Kati tukakasa nti mu Uganda tetukyalina ekirwadde ekya Ebola. So twagala okulangirira, naye tekitegeeza nti twebake kubanga mu Ebola gye twafuna yava eri Congo, ate mu ggwanga lya Congo Ebola ekyaliyo. Kati tusaba Abannayuganda ababeera ku booda ne Congo nti babeere bali alert essaawa yonna. Bw'obalaba omuntu nga atolose Congo n'ayingira mu Uganda, babuulire ab'ebyobufuzi, ab'ebyokwerinda oba abakulembeze baffe bagambe nti ono abadde Congo ayingidde mu Uganda, kubanga twakola endagaano wakati ye gavumenti ya Uganda ne gavumenti ey'e Congo etukirizingana ntugenda okukola amadwaliro eri sayidi y'e Congo ag'okujanjaba abo bonna Abakongo abalina ekirwadde. Katwakamala kutandika eddwaliro lirimu ne laboratory mu kitundu ekya Aru eri opposite West Nile, n'ekitundu eky'e Kasenyi ekiri opposite Toroko ne Lake Albert, nti kubanga tetwandiyagadde nti Abakongo abalina ekirwadde bajje mu Uganda, twagala tubajanjabire mu bitundu erya Congo. Ate twasindikayo abasawo baffe weebali. So tusaba abo bonna abali ku booda ya Congo kuva e West Nile, Bunyoro, Toro, Kigezi, abo bonna abaliraanye Congo nti mubeere bagenderevu, mubeere alert. Oba mulabye omuntu yenna nti avudde Congo mubuulire abakulembeze, n'obwolaba omuntu talina obubonero obulaga nti ayinza kuba alina ekirwadde ekya Ebola, kati mumutwale mu ddwaliro eriri kumpi, oba waliwo essimu gyegenda kubasomera, musobola okukuba essimu eri toll free, kitegeeza nti tekusaba sente, osobola kukuba n'obwoba tolina sente ku simu, eri 0800 M00 066. Kanjiddemu 0800 M00 066. Oba osobola kusindika akamessage ku simu aka SMS ku namba 67767. So kati tulangiridde nti Uganda ekirwadde kya Ebola kati kiweerewo, kitegeeza nti abagenyi abaagala kukyalira eggwanga, abo bonna bamusiga nsimbi abaagala kujja wano mu Uganda okukola eby'obusuubuzi, n'abantu bonna ensi yonna kati bali free bajje, tewali ekibatiisa ekikwatagana n'ekirwadde ekya Ebola. So tusaba amawanga gonna agabadde gagaddewo nti abantu baabwe tebasobola kujja mu Uganda, ekyo bakiyimirize kubanga tewakyaliwo kizibu ekya Ebola mu ggwanga lyaffe. Mwebale nnyo, mwebalire ddala. Yes, we can now get the questions. You raise the questions, then I will ask my team to volunteer to respond to any of the issues. So, Dr. Yes, and the team, you take note also of the issues, yes.
Thank you, Honorable Minister. My name is Abubakar Rugoa. I'm from Reuters News Agency. What are some of the things that Uganda has done to contain the spread of Ebola that some of the countries like Congo have failed to do? Because we see in just a few months, Uganda has been able to curb the spread of Ebola. What are some of those few things that Uganda has done? And then some of the measures that were taken was closure of the borders and then the markets. I don't know, are they now open to the community? What are the steps that have been taken after the announcements that were made to close all the markets and other public places? Thank you.
Thank you. My name is Hassan Mutunzi. I work with LC Africa, the content factory. Now that Uganda has been declared free, Ebola free, will government engage with the US government over issues of travel advisories that they have been releasing for the last 3 months, asking their nationals not to come to Uganda?
Thank you. My name is Edward with Dream TV. The other time, Madam PS publicly asked for almost 100 billion to fight the outbreak. We want to know how much has been spent and maybe.
Okay, she's here. She's here. She will respond. Okay.
Thank you, Honorable. My name is Najita. I work with Success Radio. Yes, we have appreciated the 42 countdown that the ministry wrote. Now, has the World Health Organization endorsed the approach?
Thank you so much, Honorable Minister. My name is Aloysius Biamkama from Mama FM. A few days we were together at the Murago National Isolation Center. And if I remember so well, it's where we declared the 42.
Yes, yes.
Not when we declared. So for us, I think counting from the last discharge of the Congolese.
Okay.
So isn't it too soon for you to declare? Because the public and the official information we have, we started counting and I've been counting. It's just 12 days.
Okay.
But now you have made it 42 days.
Yes.
And now another question, the clinics that you have put at the border, Aro and Katsenyi, are they really on about Ebola response or even other health emergencies? Thank you.
Yes, good afternoon, Honorable Minister.
Yes.
My name is Nansumba Nadira. I work with Radio Pal FM and GTV. My question is, how has this outbreak changed Uganda's public health response towards us in other diseases maybe which might come up into the country?
Come again. Restate the question.
How has this outbreak changed Uganda's public health response strategy towards maybe any other diseases that might come up?
Good afternoon. My name is Rose Ibrahim from the New Vision. Minister, I want to know how equipped are the health facilities on the border points, because these health centers were there when the Ebola was coming. So this time, how have you left them? No, I want to know
Yes.
how equipped are
How
these
equipped,
health
yes.
centers on the border points? Because the Ebola, by the time it came,
How has
just
the
phone
Ebola
them.
left them, the Ebola response? How
yes.
has it strengthened them? That's what you're asking. Okay. I've got the question.
So long as they
I
are
think in
border
Uganda.
points,
Yes.
they are on the border, means they are.
I think he asked
from
about those in Uganda.
Yes.
Honorable, I think you can respond to
Yes.
those. Yes.
I think that one, PS and the technical team, you respond later on the status of the health facilities on the border points. Dr. Yume, you can respond to Madam Nansuna's question. How has this Ebola disease changed our response to disease management? Can make a comment on it. And there was a question for the funding. PS, you'll be able to respond. Let me just comment on the others, but also when you come, you feel free to comment on any issue which was raised. Let me start with the 42 days by Biamukama from Mama FM. We said when we were at Marago Treatment Center, we said we are starting the countdown, and we have been counting. And now we have come, we are telling you the 42 days are over. The good thing, it is the same team, the same people who are telling you. Yes, traditionally, we've been counting from the last patient discharged, like we communicated in Marago. But we have since reviewed the science. Why do you count 42 days? You count 42 days because the incubation period of Ebola is 21 days. When you get infected, you can develop symptoms in a period of 2 to 21 days. So we usually count 2 cycles of incubation period. And why you are counting those days is that you are suspecting that there could be local transmission going on, which you have not detected. So within 42 days, if there was an infection somewhere in the country, it will have come out through symptoms. That's why we count 2 cycles. But now, the other gentleman I said it in the statement, the other gentleman we discharged at Marago, we looked at the dynamics. Who was he? This is a person who hid in a cargo truck coming from DRC. He hid and came as luggage, as part of the contents of the cargo truck. And when he reached town, he called, and then he came, was hospitalized. So he did not expose his sickness to any person that we confirmed. So meaning that there is no contact, there is no person who was at risk from this person. That's why we went backwards and went to the last one we had discharged. Because you see, you must be informed by science. This is not witchcraft. This is science. The reason why we count 42 days is that you are looking at the last case you discharged. Did that case expose some people to a risk? And in the case there is some risk exposed, then you give it time for it to emerge through symptoms. But in this case of the Congolese, we went back and traced. He did not expose anybody to the risk of Ebola infection. The one who could have been of risk is the other one of 16th June. That's why now we made an adjustment. It is scientific. It is scientific that the one who could have posed a risk that justifies the 42 days is the other one who was discharged on 16th June. That's why now we counted the 42 days. Instead of the other Congolese, we now went backwards and counted from the one of 16th June. Now the 42 days have ended. So we are now sure from a scientific standpoint, there is no more risk within Uganda arising from those 20 cases that we admitted and managed. Does the WHO agree with this? Definitely yes. Definitely yes. WHO also is moved by science. And actually, even all these protocols of 42 days were developed here in Uganda because Ebola is an African disease. And we have had, this was the 9th outbreak. And the lesson is learned and the experience that we went through managing different outbreaks is actually what informed most of these protocols which we use to manage Ebola. So there's no contradiction at all. And in any case, what is important is for us to be persuaded and convinced of the science and not whether we satisfy anybody outside. As long as we are convinced that what we are doing is right and scientifically correct, then even the WHO and others will adjust and conform to the science. And the learning never ends, so we are also teaching the international community that when you are managing an imported outbreak, there are these observations you have to look at. Hassan, you were asking, will we now engage the US and other countries to lift the restrictions and the travel bans that have been imposed? The answer is yes. That's why in the last paragraph which I read, we're saying now Uganda is Ebola free and is open to tourists, international travel, investors. Nobody should fear coming to Uganda on the basis of a risk of Ebola. But we have also urged, before even this statement, that the restrictions imposed by these countries were not necessarily backed by public health science. I have said this severally in the public platforms, that the Ebola disease was first identified in 1976 in Congo and Sudan, now South Sudan. That means we have had 50 years of Ebola disease. Congo is witnessing the 17th outbreak. Uganda, this outbreak, which we are concluding, has been the 9th. When you do a count in Africa, we have had up to 40 outbreaks and flare-ups because Ebola has also been in countries in Western Africa. But in the 50 years of those outbreaks, less than 30 cases of Ebola have been exported outside Africa. Actually, to be exact, if you include the recent case of France, there are 29 cases that have been exported out of Africa. And the majority of these cases are doctors and health workers who are evacuated to Europe, to America for further treatment when they contract Ebola as they manage Ebola cases. So meaning there is minimal risk of exporting Ebola through international travel. International travel, that is the evidence. So that means that the decision is taken by these countries are largely out of fear, but not backed by science. Because with science, we go with evidence. Because in the last 50 years, if Ebola was as risky as, say, COVID, then we would have seen a global transmission in Asia and Europe and so forth because of the many outbreaks we have had in Africa. So going forward, like you asked, we are going to continue engaging countries like the US, Canada, United Arab Emirates, and others which had imposed these restrictions to rethink and reconsider those restrictions so that the travel bans and restrictions can be lifted and we continue moving. Then Reuters, you were asking, my colleagues will add additional points. What has Uganda done that other countries like DRC have failed to do, and we've been able to contain this outbreak while it may be in a neighboring country, the story is not as rosy as what is here. Well, I said some of these in the statement. You see, we received a Congolese national who entered the country on the 10th of May, and he was hospitalized, died on the 14th, but the samples which had been taken confirmed Ebola on 15th May. And that's when we declared that there is an outbreak of Ebola. So early detection and announcing. Some people have been saying in Parliament, I was accused that the Minister of Health is reckless. And why did you announce? By the shadow Minister of Health. And I told her, I think reckless would have meant if we kept quiet and many Ugandans get infected, then you could say we are reckless. But we announced that there is a problem of Ebola. And then we activated our response system and made every person to be on the alert, especially the border communities, Uganda, DRC border communities. We closed the points of entry, the border. We, like you said, stopped community gatherings like markets, weddings, and all events which gather many people. We put them on hold, especially in the border communities, so that we can disrupt this potential transmission in those communities. And the sensitization. We asked the radios and media platforms, especially on the border axis, to relay and broadcast the messages regularly, daily, and some of these radios are picked on the other side of Congo. So, and then we strengthened our laboratory system. We activated our surveillance system so that any case that is in Uganda is picked early enough. So a combination of all those interventions is what helped us to contain. For instance, you recall, with the guidance of the president, we announced that we have postponed the Mugongo event, which happens on 3rd June. And when that announcement was made, already many Congolese were already trekking into Uganda as pilgrims. If, for instance, we had allowed that Namugongo celebration, that would have been a super spreader event. Probably today the story would be different. So, acting early and mobilizing Ugandans and building on the capacity and strength we have built over the years, because we managed Ebola before, we had COVID. So a combination of all these is what helped us contain this. Probably when you go to our other neighboring countries, their response may not be as robust as it has been in Uganda. But we are going to continue documenting all these for the international community and scholars to learn how we can manage some of these disease outbreaks. Lastly, you asked about the borders. Are we opening the border? Are we lifting the measures which we had announced? No. In our statement, we are saying, although we are declaring Uganda Ebola free, but there is still a risk because our neighbors in the DRC are still having a big challenge. And therefore, the border with the DRC remains closed. The measures which we announced in the border communities still stand. We shall gradually be advising the border communities on additional or flexibly maybe lifting some of the measures. But for now, our guidance is that the measures which we had imposed and guided on in the border communities remain in force as we observe what happens across in the DRC. At this point, let me invite the Honorable Dr. Yume, and then followed by the PS and any other technical person to briefly comment. Dr. Yume, there was this question of how the Ebola disease has changed or affected our response, and then make also any other comment on the issues raised, and then the PS, and then.
Thank you very much, Honorable Minister. I'm responding to the question posed that how has this outbreak changed Uganda's public health response? First and foremost, I would like to thank my colleagues from the Ministry of Health who work day and night to ensuring that we have gotten to this day, and also congratulate my fellow Ugandans for this milestone. Every time we are exposed to an outbreak, we build capacity as a country. It creates a lot of awareness. As the minister said, this is the 9th outbreak in Uganda. And if you remember the outbreak of 2001, the fatality was high. And that's the one that killed a number of people, including Dr. Lukuya. May his soul rest in eternal peace. So there's a lot of awareness that's built over time. And of course, the alerts are higher. We have seen a number of people volunteering information, and some of it is false information, but false information is good. It shows that the message has got across to the community. The second point is, as government, as a ministry, we have built capacity, laboratory capacity. In the past, most of the specimens and samples had to come to Kampala. But I want to assure Ugandans, now we have built capacity at regional level, and we have also built capacity along the border districts. And that means the turnaround time for testing samples is now less than 4 hours. I was in West Nile recently, and there was testimony by the frontline healthcare workers that when samples are collected, we no longer have to send them to Kampala, to Uganda Virus Research Institute, but we have capacity at regional level. In 4 hours, we are able to tell if we have confirmed cases. Second, my third point is on the issue of human resource capacity. We have built a lot of capacity, and we are now even able to export. You heard the minister saying we have opened 2 treatment centers in Kasenyi and Aru in the Democratic Republic of Congo. These are not expatriates, fellow Ugandans. These are Ugandan doctors, these are Ugandan health workers. The fourth point is protocols. As a country, we have built our own protocols, and these are now being referenced by international scholars and the international community like the World Health Organization, as the minister had mentioned. There's a lot of research and development going on at the Uganda Virus Research Institute, including research on potential vaccines for Ebola. I would want to tell fellow Ugandans that this time round, we did not wait for financing from outside. Government, through Parliament of Uganda, was able to allocate the initial financing to the tune of 5 billion shillings that were able to start in the management of Ebola. I would want to assure Ugandans that the health sector has remained very resilient. Ebola has not shaken our activities in immunization, in maternal and child health, in malaria. All those are running in the background, and the indicators are commendable. I thank you very much, ladies and gentlemen. Allow me now to invite the Permanent Secretary, Ministry of Health, to respond to more questions.
Good morning once again. Let me start with the facilities around the border. We have got our facilities around the border that have been there before, that are treating all diseases routinely. But also, whenever we get Ebola, depending on where the epicenter is, we adjust our services in a way that we enhance the capacity of those facilities around the epicenter. Right now, our epicenter was in DRC, and therefore we had to build more capacity in the facilities around the borders. If you remember, we told you, for example, in Wera, we have got a full-fledged lab. In Fort Portal, we have even a treatment unit there if we got more cases around. So we have those places. We have isolation centers, and it's not only just in Kampala, but even HDUs in those, like in Arua. And if you remember, we told you that those that were coming would convert some of the facilities quickly and transform them into isolation centers. Like recently, when we were getting many people sneaking in the country from DRC, they were holding them in Oli Health Center in Arua, and it is still there. And we are going to make sure that those facilities remain on high alert, because we know that our neighbors are still having Ebola, and therefore, anytime these people can come in the country. But whenever we get such people, we isolate them there, we treat them there. We have our facility in Arua that is able to test, and turnaround time is less than 4 hours. So we make sure that strategically we position the supplies. So it's not just the equipment, but even the supplies, because by the way, in Ebola response, the most important thing is that it's not just the equipment as per se. The most important thing are other supplies like PPEs to protect our health workers. That's why, despite the fact that we have got a higher burden the other side across, our health workers here have still remained safe. And so it is the supplies, it is capacity to test quickly, it is capacity to have emergency operating center where people can call, send SMS whenever there is an alert, and then we are able to respond. That's what really matters in the Ebola epidemic. Now, on the resources, when we got Ebola, we called upon partners to support, like how we always do. But this season was a bit unique. Remember that we are still in the MOU discussion, all those things. And what really we are proud of is that largely this response has been funded by government. And as Honorable Charles said, these are big lessons for us. These are big lessons for us. We are instituting mechanism, and I believe even the next epidemic, we will be even in a better position to handle our own response. And we are going also to restructure in a way that we have more human resource that can do this work without depending largely on the external support. Government committed $5 million to this response, and it's the one that helped us. But also other partners that came with the money, unfortunately, they were not bringing the money to government. They were supporting, they pay for communication in talk shows, they pay for some supplies, they pay for some allowances of their people they are deploying, and so that one I can't quantify, because although they would declare, but we do not know to what extent, how much of that money they have spent or not. But for us, we can confidently say that government committed resources, and it has really, really helped us to deal with this. Even right now, in DRC, where we have deployed these people that we are paying every single day, and in these 2 centers, government is supporting this initiative because we know the burden. If we do not support our people, the other side, it can cost lives. So we cannot gamble on this kind of support. So even in DRC, we are supporting. Allow me also to add something on what we have learned. In this epidemic, it has been quite unique that we had to balance so many voices, so many entities. We had so many players, authorities, and everyone comes with it because we have diplomacy. We had to deal with, and we continue to deal with that diplomacy because we need to harmonize our approaches. We need to harmonize our protocols. The reason we're able to successfully control Ebola here is because we have a very clear, systematic way of doing things. When we get Ebola, first of all, how did we get that Ebola? Mortality surveillance. Would never have known that that person died of Ebola if we are not doing mortality surveillance. And that is a very strong component. Anybody who dies with features, we cannot just ignore. We must take the sample and test. That is number one. We have very strong political will in this country. We have our champion, the President of the Republic of Uganda, and we work as one government. That's why when we are having our national task force, the Vice President chairs it, and all the MDAs are represented there so that we have security, we have internal affairs, we have trade, we have tourism, we have communication, we have everyone in that so that it is one government. So that political will and better coordination helps us to agree quickly, make quick decisions. Number three, we have got a very elaborate system in the community. We have community extension work, we have VHTs, we have epidemiologists we have deployed in all these places. We have emergency operating center that 24 hours we get alerts and we are able to respond. That whole system gives us in real time information and we respond. Number four, we have got experienced health workers. That's why you have not, in all these epidemics, you have not had anybody, any health worker getting infected in the ETU or in the lab. We have now flexibility of taking our mobile lab where there is epicenter in 24/7. We have infrastructure that we convert in less than 4 hours of knowing an epidemic. ETU is up and running. That's why when we were able to quickly pick the contact and put in our isolation center. Immediately, we converted that in the shortest possible time. We also, we are proud that our human resource in the country that have been involved in this, they have been also part of the international community that shape the protocol, the method, the way how things should be done. Even this time around, we are going to set the protocol for this. Because I know that people are saying, now 42 hours, now 42 days, the last one. No, we are differentiating because it is us who who put up those protocols. The protocol of local transmission, the protocol of imported case. The two are separate, so we cannot mix them. That's why we are saying 42 days of our local transmission, because that was the rationale, that was the science, as Honorable Minister explained. This last one the dynamics, the science, the epidemiological picture, and the whole analysis of the case, they do not warrant for 42 days after, because this is someone, as Honorable Minister explained, who came hidden in the sacks of goods and got here and called us and we picked him. So no contact, no, so there is no reason, there is no science for us to start counting 42 days of after that patient. We have got a very robust laboratory system that if we got Ebola in Katakwi, today the lab would move there in the epicenter. It would not take, so many days, and that these are the lessons that we are engaging our colleagues across to embrace, because these are the strengths of us managing the epidemic. I think I've answered the questions. Is there anything I've not answered? The what? Uganda. Honorable Minister, yeah. The measures, which measures? Okuwangula obuwuka bwa Ebola n'obulwadde bwa Ebola mu ggwanga lyaffe bisinzidde ku nkola yaffe gye tutaddewo okumala emyaka gino gyonna. Nga Honorable Minister bw'ababuulidde, guno mulundi gwa 9 nga tufuna obulwadde buno. Buli lwe tufuna obulwadde buno wabeerawo bye tuteeka mu nkola ne tunyweza response yaffe. Era ne ku luno naye era nakyo waliwo lessons etwayize. Lesson esooka kulaba nti nga government tuyina okulaba nti tuyina obusobozi obufandinga response yaffe ne tutalinda balala. Ekyokubiri, tuyina political will oba abafuzi baffe nga bakulemberwa President Yoweri Museveni ye chief public health specialist gwe tuyina mu ggwanga muno. Buli lwe tubeera n'ekizibu ky'obulwadde obubaluseewo, yasooka okukola ki? Okukuba omulanga, era mumanyi nti yakuba omulanga. Ate ne task force yaffe erimu ministries oba ebitongole ebirala ebya government, tusooke tulyoke tukolere wamu. Era national task force yaffe mulimu agencies endala ze tukola nazo. Ekirala, tusobodde okuzimba obusobozi obusobola okurespondingirawo oba bwabeerawo obulwadde obuba bubaluseewo. Abasawo baffe tubalina abatendeka obulungi, abalina experience. Ky'oba olaba nti mu Ebola zino zonna ze tufunye, tetufunye bantu balwadde abajja obulwadde mu treatment center oba mu lab. Tuzimbye obukugu obwo. Ekirala, tusobodde okuteekawo infrastructure oba lab capacity esobola okugenda wonna wetubeera tufunye obulwadde wonna. Tuyina system mu community workers, VHTs, our system, our EOC operating centers oba we babeera nga batuweereza any alert. Ezo zitusoboseza 24/7 okumanya ekiki ekigenda mu maaso mu ggwanga lyonna 24/7. So n'olwekyo tetusobola kuluzinga obudde, tetusobola kubeera n'obulwadde mu ggwanga ne tumala omwezi mbu tetutegedde. Tekyo tekisoboka, kwaki kyekyabaawo mu baganda baffe ab'oku muliraano. Twaluzinga obudde buwanvu nnyo, twadeclaringa olunaku lumu lwe baali badeclaringa ng'ate obulwadde bwasaasaana dda. Ekyo tekigenda kubaawo mu ggwanga muno, ekyo tekisoboka, kubanga tulina obusobozi obucoordinating ne tumanya ekiba kibaluseewo kyonna. Obulwadde bwonna ne bweba malaria nga tufunye surge, era nayo tugimanyirawo, era ne tugenda ne tukola response. Ekirala, tusobodde okuteeka infrastructure ku border kati nga ku luno. Kati lab yaffe ey'Ebwera esobola okutestinga awo wewabeerawo ekintu kyonna n'abali suspected bonna sample tuzitwala bwera. Abali mu West Nile sample zaffe tuzitwala West Nile. So wonna we tubeera tulina capacity okumanya. So strength yaffe eri mu kumanya amangu ekiba kibaluseewo ye strength yaffe. N'ekirala okumobilizinga abasawo baffe ababeerawo. Ekirala okukozesa infrastructure yaffe eriwo kubanga isolation center teyatutwalira na ssaawa 2. Isolation center yali eriwo era bwe wabaawo ekyo ne tujjayo abalwadde ne tuba. Ate success story yaffe ya Uganda. Lwaki abalwadde baadde baagala okujja nga bava Congo bajje wano bajjanjabirwe wano? Kubanga balaba nti abaffe tebafa. Abalwadde baffe tebafa betujjanjaba. Tebafa. N'oyo yafa mu ETU lwakuba yajja nga muyi ng'anaatera okufa bwe yatuuka awo n'afa. Naye abalwadde baffe ffe be twejjanjabidde bwe tubafuna nga bukyali ne tubajjayo nga bukyali tubajjanjaba ne bawona. Eyo nayo success story. Era bw'otunuulira case fatality yaffe abaawano ne banneighbor baffe kiri kitiisa. Mwebale nnyo mwebale ddala.
Factors, one, the PS talked about it, but the burial practices, washing of the dead bodies, an infected person who dies of Ebola is so far infectious. So all cautions must be taken as the burial process. That's the difference between the response we are seeing now. Nobody should be buried if they have been sick by the community. Finally, we do a very expensive but effective approach. All the high-risk contacts in Uganda were quarantined, and we knew where we're there, and we are monitoring. So that should somebody start getting symptoms at the time when they start being infective, they were with us. So that's why you saw no transmission. If we are going to teach the world, that's the approach which is going to be effective in managing.
People must continue to report deaths, especially if they're along the border?
Yes, people along the border will continue because now we have gone back to preparedness and being alert. So we should be reporting at the border, we should be screening, we should be making sure that no person passes through without being screened.
And if someone dies?
No burial without us knowing. We need to take the sample for any burial. We need to support the burial system so that we don't lose or contaminate. If we are not aware, we do a dignified, safe burial. And that's the support that we will continue alongside the borders and also keeping part of the surveillance, so mortality surveillance.
And the health facilities along the borders are ready to do that?
The facilities at the border are being trained, equipped, and also facilitated by some of our support agencies to make sure that does not happen. So people should ask, why are you taking my body for post-mortem? Why are you testing? It's because we want to make sure during this time when we are suspicious to rule out every kind of possibility.
And the checks along the border continue? The checks, health checks, the port of health?
So we are maintaining port health, and you know that border is still closed, but should we allow cargo to pass through, the cargo staff are only 2 and they are going to be checked, and we track them through the whole country until they exit or 21 days after they have returned into this country. That surveillance remains and is still in effect.
One last question for you before you go. You're a health practitioner, just like Dr. Bariomusi, just like Dr. Ayume and Dr. Twine, but just give me a sense of how important the health workers in Uganda are, the frontline workers. How important have they been in this pushback effort?
First of all, we congratulate all our health workers, first for being brave, not running away. 2, taking heed when they heard there is an outbreak, then they up their game of infection prevention control. Because every person walking to you comes with a fever, you can't distinguish between a fever of malaria, of another illness, from Ebola. You can't know why they are vomiting or they're having diarrhea, so you have to be cautious in how you handle both yourself, but also the patients that's before us. So the health workers are the gateway, whether that disease stops or continues, and them have high suspicion of every case that they get, knowing that there is a possibility of being anything. So we don't allow them to take samples and put them in the lab without decontaminating. Don't touch any patient without gloves. Don't expose your clothes, and know where this patient came from. Travel history now becomes important for every patient we manage.
Thank you very much. Ebola-centered press conference, and I know there's some journalists who might have other questions that are directly related to the Ministry of Health. You can have those questions at the end of this press conference, which we must bring to a close very soon. But as an observer, I just want to first of all say thank you very much. Every Ugandan owes President Museveni a debt of gratitude, because the president has led this effort from the front. He has been commander-in-chief of the pushback effort. He has prioritized the health and well-being of Ugandans from the very beginning. And for that, on behalf of many Ugandans, I know I speak for a lot of them when I say thank you very much. And also for the health workers in Uganda who have responded effectively and decisively. They have been at the forefront, making sure we are all safe, educating us, and making sure that we as Ugandans know how to respond to this situation. Again, Uganda is leading the world in as far as not just Ebola, but other hemorrhagic situations are concerned. These hemorrhagic fevers come to Uganda to die. They die here because we are resilient and we know how to deal with them decisively. So make no mistake about it. And my last message goes out to the tourism sector. I hope that you have an opportunity now to redeem whatever you can in what has been a horrible season for you because of the unfair characterization of Uganda by countries that chose to do what they did. Our only hope is that you can redeem whatever you can in the time that is left in this season. And we thank you for your cooperation despite all the difficulty that a lot of you have had to endure. Thank you very much for showing up on a public holiday and on such short notice. On behalf of Uganda Media Center, thank you. And until next time, God bless you for God and my country.